Hello and welcome to GastroVision. I'm Dr. Kazi Sohail from Government Medical College, Srinagar. In today's video, we will be exploring one of the most important anatomical regions in endoscopic ultrasound, the biliary hilum. In this video, we will start by moving step by step to identify the portal vein, common bile duct, and caudate lobe. Before analyzing how the two limbs of gastrohepatic ligament and hepatoduodenal ligament appear on endoscopic ultrasound, we will also discuss how these structures can interfere with biliary imaging, why acoustic shadowing or dropout may occur near the ductal confluence, and how to optimize your imaging technique to overcome these challenges. Let's take a look at this endoscopic ultrasound image obtained with the transducer positioned near the gastroesophageal junction. From this position, a clockwise rotation of the EUS probe moves the imaging axis from an anterior orientation within the stomach to a more lateral position, where the liver hilum can be beautifully visualized. Here the liver is seen as a fine granular homogeneous ecotexture located just beneath the probe. This represents the left lobe of the liver, which comes into view as we rotate the scope rightwards. Deeper to this tissue on the caudal side, notice the anechoic tubular structure with bright echogenic walls. This is the portal vein. It serves as a key landmark when tracing the biliary tree, as the common bile duct typically lies just anterior to it. Now, just look anterior to the portal vein. This anechoic tubular structure is the common bile duct. It appears as a parallel channel running alongside the portal vein, forming a part of portal triad. Its walls are thinner and less echogenic compared to the portal vein. As we follow the CBD proximally, it leads towards the liver hilum, where it joins the right and left hepatic ducts to form common hepatic duct. Distally, it continues through the hepatoduodenal ligament, heading towards the pancreatic head and ample of water. In this image, the CBD is seen in the deeper acoustic field, while the portal vein lies just posterior to it, and the liver occupies the near field close to the probe. This configuration, CBD anterior, portal vein posterior, is classic for transgastric view at the GE junction station. Now moving to the next image. Here, the transducer remains positioned near the gastroesophageal junction, providing a detailed view of the liver hilum and its surrounding ligaments. You can clearly see the two limbs of gastrohepatic ligament. The first limb runs along the undersurface of the liver. Since inferior structures are displayed on the left side of the image, the limb appears towards the left. It ascends superiorly, coursing just behind the portal vein and anterior to the caudate process. The caudate process forms the posterior boundary of this view. Within the caudate lobe, notice a small anechoic circular structure. This is caudate vein, which drains directly into the inferior vena cava. Because the caudate lobe is in the central acoustic field, it appears right in the center of the image. Just anterior to the caudate lobe, you can identify the portal vein, seen as a large anechoic tubular structure with echogenic walls. Notice how it travels from inferior to superior, that is, from left to right on the image. As it ascends, the portal vein also moves away from the probe, meaning it is orienting anteriorly, giving off segmental branch near the level of the probe. The second limb of the gastrohepatic ligament extends between the abdominal part of esophagus and the liver. This limb appears echogenic, and together with the first limb, it can partially obscure deeper structures when the probe is rotated. Just anterior to the portal vein, we can see the hepatoduodenal ligament. This structure lies posterior to the common bile duct, but anterior to portal vein. It is visualized in the inferior field, consistent with its anterior anatomical location. The common bile duct is seen in the deeper acoustic field, confirming that it lies anterior to the portal vein. It also appears on the left side of the image, which corresponds to the inferior aspect in this orientation. During rotation, the hyperechoic gastrohepatic ligament between the esophagus and liver and the hepatoduodenal ligament near the liver hilum can create acoustic interference. This may obscure the right and left hepatic ducts near the confluence, causing partial acoustic shadowing or dropout. On the right side of the image, note the large anechoic tubular structure. This is inferior vena cava. You can also see middle hepatic vein joining it, which is an important venous landmark when orienting hepatic hilum during endoscopic ultrasound. To summarize, the endoscopic ultrasound view from the gastroesophageal junction elegantly demonstrates the portal triad, caudate process, and the key ligamentous structures, the gastrohepatic and hepatoduodenal ligaments. These ligaments, although vital anatomical landmarks, can interfere with ductal imaging when the probe is rotated. Understanding this relative orientation, superior, anterior, and inferior, it is essential for accurate biliary mapping during endoscopic ultrasound. Thank you for watching. See you in the next video.